Hello everyone. We know Medicare is extremely confusing, so guess what? We are here to make your life easy by making Medicare simple. Every single day you're faced with a relentless amount of advertising begging you to click, call, or answer to something. Yet TV ads can be slick. They don't answer your deep questions about Medicare. No advertisement does. So welcome to Medicare Deep Dive, where we dive deep into questions every single senior has about Medicare. Hi, my name is Kelby Hightower with MedicareHub. Today I'll be walking you through another deep dive on Part A benefits on how long-term care in a long-term care hospital works. Plus we'll cover your costs if you choose to stay on original Medicare. Stay tuned. Long-term care hospital specializes in treating patients that are hospitalized for more than 25 days. Patients may include people who have used ventilators for an extended period of time or experienced severe wounds or head injuries. After being discharged from the long-term care hospital, many people get one of these. One, care in a skilled nursing facility, which we just covered. Or they're assigned custodial care in a long-term care facility. A lot of times after a brain injury, traumatic brain injury. So if you choose to stay on original Medicare, your cost for long-term care hospital care can be extremely high. So as I dive into what you pay on original Medicare, keep in mind that we would suggest going on to a Medicare health plan that covers all or the majority of these costs. So just a quick reminder, a benefit period begins the day you're admitted into an inpatient hospital or skilled nursing facility. The benefit ends when you haven't received any inpatient care or skilled care in a facility for 60 days in a row. So your cost to stay in the hospital will be broken down into the following. If you stay day 1 through 60, you will automatically pay the yearly deductible, which is right now $1,556 for now. Days 61 through 90, you begin to pay a $389 coinsurance each day. For you guys that love to do the math, that equals $11,281 plus the deductible we just covered of $1,556. Day 91 and beyond is $778. And then you begin each day to after 90, you begin to use up your 60-day lifetime reserve days. So if you have 60 days that you can be used up over a lifetime, if you surpass 91 days or beyond, after you have used up those days, you're responsible for all the costs beyond 91 days if you ever stayed in that long in the hospital again, or you're responsible for the daily coinsurance of $778 for each lifetime reserve day you haven't used. After you've used up those days, you pay all the cost. However, you don't have to pay a deductible for care you get in a long-term care hospital if you are already charged a deductible for the care you get in a prior hospitalization stay within the same benefit period, which is over the past 60 days. This is because your benefit period starts on day 1 of your prior hospital stay, and if that stay counts towards your deductible, for example, and this is kind of a good example, you're transferred to a long-term care hospital directly from an acute care hospital. You won't have the deductible. You're admitted to a long-term care hospital within 60 days of being discharged from a hospital. You won't have the deductible. So what's the elephant in the room that you need to really face when looking at just having Part A of original Medicare? One, you're subject to a high deductible, the $1,556. You're limited to just what is covered under hospitalization. As you will see in our video on what's covered under Part B medical services, most doctors aren't covered under Part A, and therefore you'll be billed a 20% charge for the fee for service amount set by Medicare for that doctor's care. Plus, don't forget you're paying the Part B deductible for the year. Enormous costs can incur quickly when being billed 20% fees for specialists during a hospital stay. We want every person to know the risk and exposure so they can properly choose a health plan that can cover and insure most of the costs or all the costs I will cover in these in our videos about Medicare Advantage and Medicare supplements and the plan options you have. When a person is on Part A and B and are equipped to unlock the door really to a health plan option. We like to cover those options with you to really allow you to make an informed decision of what health plan choice you need to cover all or most of those out-of-pocket costs. So don't forget, we're really here to make your life easy by making Medicare simple. Guys, follow up with us and follow along as we go into another deep dive video here shortly. Thanks a lot.